Our next speaker is Dr. Nisarg Thakkar. He has done his post-graduation in radiology and fellowship in interventional radiology. He has joined Dr. Rosal Gandhi's team and has keen interest in carrying out uterine artery embolization, which is a very useful non-invasive technique for treating uterine fibroids. I would like to invite him on the dais.
Good afternoon, everyone. So today I am going to talk about uterine artery embolization. So what are the indications? Uterine fibroids. Uterine fibroids causing menorrhagia, that is heavy uterine bleeding, pelvic pain and pressure symptoms, fibroids with otherwise undiagnosed infertility, and as a preoperative measure for large fibroids. Another indication is uterine AVM, that is because of the trauma and post-curettage. Now, what are the contraindications to uterine artery embolizations? The first contraindication is to contraindication for angiography, that is having previous anaphylactic reaction to contrast media. Other contraindications include pregnancy, active pelvic infection, and prior pelvic radiation. Now, what are uterine fibroids? They are benign smooth muscle tumors of the uterus. The smaller tumors are generally asymptomatic, but larger tumors can cause pain, heavy uterine bleeding, and pressure symptoms. So, risk factors for the uterine fibroids include a high level of estrogen and progesterone that occur in breastfeeding women and pregnancy and perimenopausal individuals. So, there are basically three types of uterine fibroids. The first one is submucosal, that is within the endometrial cavity. The second one is intramural, that is within the uterine wall. And third one is subserosal, that is under the perimetrium. So what are the treatment modalities? So, non-surgical treatment modalities include uterine artery embolization. The second one is MR-guided focused ultrasound surgery. The surgical treatments include surgical removal of the tumor, that is myomectomy, and the other treatment is hysterectomy, that is surgical removal of the whole of the uterus. So now, how does uterine fibroid embolization work? So we basically block the uterine artery that supply the fibroid that causes them to shrink. It's a minimally invasive technique. We do a tiny nick of incision at the groin, and we take the uterine artery angiography, and we identify the vessel supplying the fibroid, and we inject the tiny embolization material, that is PVA, and we block the vessel. And patient is conscious, and we give painkillers, and there is no need of anesthesia. So this is a diagrammatic presentation. So we puncture the femoral artery, and we take the angiography of both the uterine arteries, and we identify the vessel supplying the fibroid, and we super selectively cannulate the artery and embolize using embolizing material. So benefits of uterine fibroid embolization: there is no need of longer hospital stay. Generally, it needs lesser 1 day of hospital stay. Patient can be discharged in 24 hours. Many women resume their light activities from the very much next day, and they can return to normal activities within 7 to 10 days. 90% of the women who had procedure experienced significant or total relief of heavy bleeding. 85% female have it's effective for the pain. Recurrence of the treated fibroids is very rare, and it's a minimally invasive technique, and patient is conscious, no need of anesthesia. The benefit of uterine fibroid embolization over hysterectomy: there is a lesser hospital stay, recovery time is very faster, and complications are very less. The risk of uterine fibroid embolization: it includes moderate to severe pain just following the procedure. After following the procedure, other complication includes nausea and fever that can be managed by non-steroidal anti-inflammatory drugs. Infection can occur that can be managed by antibiotics, and there is 1% chance of fibroid expulsion. What do I have to do after the procedure? Generally, anti-inflammatory drugs are prescribed following the discharge. Patient can start their normal activities within 6 to 7 days and can come for a checkup after 1 to 6 months. So we will go upon the cases. The first case: 29-year-old female came with a heavy uterine bleeding, and MRI was advised. MRI shows arterial hyperenhancing lesion within the endometrial cavity, and 3D angiography showed arteriovenous malformation. So we did an angiography. Angiography of the right uterine artery showed hypervascular blush and early venous filling, that is arteriovenous malformation of the uterus. The super selective cannulation of the AVM was done, and was embolized using PVA particles, and post-embolization picture showed no residual filling. The second case of 39-year-old female presented with multiple large uterine fibroids and having menorrhagia and pain. So uterine fibroid embolization was done. This is the angiogram from the bilateral iliac arteries. It showed large area of tumor blushes from both the uterine arteries. The superselective cannulation of the left uterine artery was done and was showing large area of uterine fibroid, showing large and hypervascularity. So it was embolized using PVA particles, and post-embolization angiogram showed no residual hypervascularity within the lesion. Similarly, right uterine artery embolization, right uterine angiogram was taken, which also showed large uterine fibroid. It was embolized, and post-embolization angiogram showed no residual hypervascularity. This is the final bilateral iliac check angiogram, which showed no residual hypervascularity supplying the uterus. This is the last case. 34-year-old female operated twice for the myomectomy done. Second time ադեշիալ lysis was also done, but patient still having multiple fibroids. So angiography done. The pre-embolization angiography of the left uterine artery showed large area of hypervascularity from the left uterine artery. So embolization done, and the post-embolization angiogram showed no residual hypervascularity from left uterine artery. Similarly, right uterine artery angiogram taken, and it showed no residual, after embolization, no residual hypervascularity seen. So uterine fibroid embolization is a very useful technique. It's a less invasive with a lesser recovery time, and so patients can start their routine activities within few days as compared to hysterectomy. Thank you.